morning, everybody. We are having Dr. Rakesh Periwal with us. He's an intensivist and consultant medicine by nature, and he's a huge experience in the field of medicine and critical care. So, welcoming Dr. Rakesh Periwal for today's session.
Thank you. Welcome, everybody. We are here today to talk about ambulatory blood pressure monitoring. And ABPM, although not very popular, has been in vogue for the last 4 decades. And the major problem was actually with the hardware, the kind of device that we needed. The earlier devices were bulky, very difficult to use, not very patient friendly. A lot of advance has been made in the hardware, but probably what has made significant strides is in the software, so that the reports are very easy to interpret and see. ABPM is testing of blood pressure at a regular interval, usually over a 24-hour period. That's a standard. You can have extended periods also, but generally we mean 24-hour ambulatory blood pressure monitoring. And this obviously would include the period of wakefulness and sleep. And the device is a size of a mobile, generally very light. It can be worn around the chest with a strap tied, and there is a cuff just like a BP instrument cuff, which is attached to the really non-dominant arm. You got to have the right cuff size, and you can start the test. The device is generally connected in the physician's office, because we would like to take the first reading there itself and validate it, and then can let the patient go home and have the rest of the readings and come back with the device, whereby we can download. The readings that are generally taken are every 20 to 30 minutes during daytime and every 30 to 60 minutes during sleep. This can be pre-programmed, so you can have lesser number of readings if somebody has discomfort with the inflation of the cuff, and that is a main reason why we decrease the number of readings at night, so that sleep is not disturbed. And all this can be downloaded into a computer, generating in a software, and the report is out in 10 to 20 seconds. It is in a tabular format where you have all the numbers, the time, the number of valid readings, and then you can have a graphical presentation which tells you the pattern of the blood pressure over 24 hours. So you can read it in many different ways. The question arises, why do we need ABPM? Well, we have always been checking blood pressures in our office. We are also asking our patients to check blood pressure at their home. And this has become more of the norm now, just like blood sugar monitoring. And that is because of the improvement in the devices. Most of them work on the oscillometric method, which is also the method which is used in most ABPM equipments. There are standards which are given by various guiding societies of Europe and America of the quality of ABPM and also of the software, how the report should be generated. So there's not much to worry about the accuracy of the devices. They fairly give you very accurate results.